This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon.
Yeah,
Dr.
I'm
Martin,
really admiring your glasses, Amy.
Thank you.
Your glasses are looking on point.
They're very pink. Do they make me look smarter?
You're like Sally Jesse Raphael.
Oh my gosh.
Yeah.
Red. She always wore those red
Yeah,
glasses.
but you got pink.
Yes. So these are
You should
pink.
wear those more often. I like it.
They're my blue. They're actually my blue blockers, ironically enough. The
They
pink
look
glasses.
good.
Thank
You
you.
have nice, pretty eyes, and your glasses look good. So
Thank you.
you got it going on.
Well, if you are listening to this and you'd like to see my fabulous Sally Jesse Raphael glasses, you can find us on YouTube at Jason Martin MD on YouTube. We appreciate you listening no matter where you're listening from. And this episode is going to be really awesome. And it's one of our favorite types of episodes to do because we are answering your questions.
It's amazing people actually left voicemails.
They did. So I'd put out a plea. I'll call it a plea.
I mean, it was embarrassing.
For voicemails.
It was desperate.
Prior to our 100th episode. And unfortunately, these didn't make it for our 100th episode, which was a few episodes ago. This is 103.
You're right.
So we didn't have them to read then, but I did get them after the fact, which is super awesome. So still going to answer them all today. We have questions that were left via voicemail and then also a great one from YouTube. And just as a heads up to everybody, we love your questions and your comments. I do try and answer everything really quickly on YouTube.
Yeah, you're really good about that.
This one I saved just because it was a really unique question and I really loved it. So I saved it for this episode. So if you would like to write in with a question, you can certainly text us. You can leave us a voicemail. The number is in the comment or in the notes, but it's also, I'm going to say it one more time. It's 303-630-9038. So there's these lovely ladies who left us messages. That's where they left them.
Way to go, ladies.
You can also shoot me an email or a text or whatever. Send me a smoke signal. We love your questions.
All right. Let's get going.
Let's get into it. So our first one is a voicemail from Karen.
Hi, this is Karen. And I just need to give you a little history before I ask my question. 20 years ago, I had radiation therapy for vocal cord carcinoma. I recovered completely, and I'm grateful for that. I had a reaction to the radiation, though, a burn on the front of my neck, which left like a rectangular red patch that eventually faded to light brown mottling. I can deal with the discoloration, but I was also left with a turkey gobble right above the radiation field. I was told by several surgeons, approximately 10 years later, that they would not want to perform a traditional neck lift or liposuction due to a risk of vascularity in that area, and if they stretched the skin, that could be a problem. In other words, it could turn black and fall off. One surgeon said he would do a direct neck lift or a men's neck lift, and another said he thought it would be just fine with a regular neck lift. But he would not be able to pull the skin as tight as he normally would and asked me not to expect a whole lot from that. This was about 10 years ago when I was 55. I'm currently 66 years old. When I was 55 years old, I gave up on my neck and decided to have an upper and lower eye lift instead. I figured that was safe. The result was not optimal. The stitches failed at the outside lids. I ended up with, I believe it's called ectropion. The surgeon sewed my outside lids up the best he could, but then I ended up with eyes that were smaller than original and asymmetric. There's a small hole at the outer lid of one eye, and the other eye has some mild scarring. Do you have any suggestions for me, or do I just have bad luck or overly stretchy skin? My neck still really bothers me, but my eyes bother me maybe even more. Thank you for any advice you can give.
Well, let me first off say, Karen, thank you so much, because you did listen to the episode where I asked for 100th episode submissions, and it just unfortunately didn't make it in time. But I so appreciate you sending pictures as well, which we're not going to share on the video just because they are of this patient's face or this woman's face. One thing I'm going to say before Dr. Martin starts to give his advice that we said before all of our Q&As is that we're not your doctor. So this is an educational podcast, but it's ultimately, for entertainment purposes. Dr. Martin is not your physician. Even if he was, this is still not the platform to get medical advice. So the things that we say are just for entertainment. They're not meant to be taken as medical advice or something that you should do. So again, really appreciate you sending in the picture and the voicemail.
We need a voice in the background that reads really fast, some legal.
Well, we have it. It's on there.
Okay,
it's
sure.
it's in the beginning. So let's first start off.
By the way, I just want to say,
neck.
Karen, how many patients have I seen in my career that have had vocal cord carcinomas?
Yeah.
None. So that's super rare. The fact that you survived that, I'm not sure how.
With your voice.
Right. And your voice is intact. God bless. Secondly, you definitely had some radiation changes looking at the pictures. This is a very complex case, so I get it. When you have areas of radiation, what radiation does, it kills, the majority of the stuff that is there. And that's the point of radiation, is to kill tumors. But it can kill normal tissue. And that can be the skin tissue itself, or the dermis, or even the fat underneath. All these areas can be affected. And you can have long-term changes from radiation. You see that all the time in breast cancer treatment. People get lumpectomies with radiation. They come into our office with deformities and asymmetries, primarily from the radiation itself.
And skin changes. Even without burns, there's still just a look of radiated skin that is different.
Right. 10 years ago, they were probably doing, even stronger versions of radiation. Now they do a little more localized, but it's hard to say since I'm not an expert in vocal cord carcinomas or
There's
cancers.
just not much soft tissue there.
Exactly.
Like it would seem like an area with less soft tissue would, have maybe a higher incidence of burns just because there's less tissue less fat, less everything to kind of absorb that radiation.
Right. So if we're sitting at the board test and Nils is our instructor here, okay, you would the correct answer is to not go in the area of radiation for an elective procedure, right? That's the correct answer, because the risk are kind of outweigh the benefits. Okay, elective procedures are not necessary. You're not doing some medical treatment. You're doing something to make yourself look better. And in the eyes of medicine,
that's not life-saving.
That's not life-saving. That's not going to give you a benefit. But it doesn't mean you can't go on the sides. The area, if you had a pretty strong understanding of where the radiation was administered, it doesn't mean you can't go on the sides and do what we call a closed neck lift procedure and onto the face. And that's going to make it at least 40, 50, 60% better. So you're going to have a noticeable change just from staying away from the radiated area and lifting from the side. That's around your ears, around your occipital hairline, the hair behind your ears, and onto your face. You can benefit the face too, because you definitely need a little bit of a facelift also. That's something I would definitely consider, and that would offer you improvement, make you feel better. While staying away from the radiation. The person that you saw 10 years ago who said you could probably just go in there and be fine, they're probably true. That's probably correct. But still, the risk would be higher because of the radiation. And the correct answer is don't touch that area with an elective procedure.
Yeah, and it would be hard, I think, to do a direct excision over that area because it's wide. And
the reason why they're saying direct excision and not just create a flap is the flap is the problem, right? Undermining is the problem. But if you do a direct excision, which I do in radiated areas all the time, take out a bad area, it tends to heal really well. Not guaranteed, but tends to heal better. And you won't have what you're really concerned about, which is loss of the blood supply in the tissue. And then you get something called necrosis, or the tissue just dies.
Yeah, and that's what she alluded to in her.
But the direct neck excision would be great. And to be really novel would be to do the closed neck lift first, lift everything from the side, let you heal for 6 months, and then come back and do the residual direct neck excision. That would be the smart way to do it that Nils, our board instructor, would agree with, or at least wouldn't fail us on the board test.
May not fail.
Did we fail yet, Nils? Okay, good. All right. The lower eyelids and upper eyelids.
Yeah, the eyes are more...
Yeah, I mean, if having ectropion for overly aggressive lower eyelid surgery is not uncommon. The answer to that is resuspension, which it looks like you had. It shortens the eyelid, and you can do more resuspension procedures, but that's always going to run the risk of shortening the eyelid. Your asymmetry on your lower eyelids is not really that bad, so I wouldn't really get too aggressive with that. Redoing that little pitted area on your right side, I feel bad because people aren't seeing these pictures, but redoing that little pitted area on your right side would not be hard. You could do that in the office.
Yeah, the one thing we just talked about in our episode about lower blepharoplasty, in all things with the eyes, like once you make that cut, you can't go back. And there are definitely things that can happen with the eyes in general that can be kind of permanent. I mean, I think, an issue where something is scars badly, that can usually be addressed. Asymmetries can usually be addressed, but there are some things that definitely can't. And, if you have any issues prior to surgery, like dry eyes or anything like that, that's why we tend to shy away and or treat those extremely conservatively.
Just FYI for those listening, ectropion is when the eyelid kind of rolls out away from your eyeball. And that seal of the lower eyelid with the eyeball is really important to maintain functionality in your eye.
Lubrication.
Right? So there's certain glands there that have a specific name that kind of release this stuff, and you need that.
These ones. They're the lacrimal glands.
Yeah, and the Mobian glands, along the eyelid. This is how it works and keeps your eye hydrated. Dry eyes are really a difficult problem. So over aggressive lower eyelid procedures where you remove too much skin, people that don't heal right or have swelling problems can have problems there too. That's why lower eyelid surgery should be conservative. Upper eyelids, in looking at this patient's pictures, she needs more removed.
But it was also 10 years ago.
I understand.
Yeah.
So just because you do your upper eyelids doesn't mean it's going to last forever. It could, but doesn't. So doing revision surgeries in the upper eyelids would help, even a brow lift, that kind of thing. But, eyelid surgery is really tricky. And that's kind of a take home from this voicemail is that, you can have problems with eyelid surgeries. You need to be very selective who you pick for that surgery.
And really, I feel like if we, were to see this patient in the office, we would likely refer her to an oculoplastic surgeon if she was wanting to address some of these more complex issues with the eye as far as the suspension of the lid and some of these deeper issues.
So although we do functional surgery here, and I do it all the time in cosmetic surgery, insurance will actually pay for a lot of these things. So why not send you over to a specialist that does really the reconstructive work? That's the ethical thing to do.
Yeah, to help with some of the deeper issues.
This was awesome. I mean, if every episode could be like this, I feel like we're like doing case studies.
I know. It is really awesome.
We should bring the fellows in here and I just yell at them the whole time. Like, you're so stupid. How do you not know what to do?
Well, and something, I really feel like, approaching everything from a place of like really, empathy is what we try and do in our practice. But, when someone is brave enough to share their photos and their experience, I get it. Like people who have cosmetic procedures that don't have the outcome that they like tend to have a lot of guilt associated with that because it is elective. And you're like, well, I can't feel bad about this because I chose to do this. And that's just not true.
That's not true.
Regardless of what led you down this path, like it doesn't mean that you should take blame upon yourself for the decisions you made or that something else can't be done.
Right. And there's a big part of what happened to Karen is that she was unfortunate, just bad luck that she had this kind of like really rare cancer. I'm assuming it's rare. It has to be. And the treatment was pretty caustic, so she's made it through that treatment. Thank God. She still has her voice. So there's a lot of positives in this. And Karen, thank you for your strength to reach out to us. You do have answers, a closed neck lift and then direct excision, maybe it's 6 or 8 months later. Again, there's so many different ways you could do your procedure. You could just do the closed neck lift or don't elevate the areas that have been radiated, pull from the side.
Hit that lower face really aggressively.
Do the facelift. All these things are going to benefit you. The lower eyelids, it's hard to give you recommendations on that because that's really an in-person exam. Upper eyelids, you need those revised or a brow lift. Yeah. All right, next case, but thank you, Karen.
Awesome. Thanks, Karen. All right, so we're actually going to take a quick break to get a word from our sponsor, Let's Get Checked, and we'll be back.
We'll be back.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically, you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab or you're afraid of the blood draw or just, you're concerned about confidentiality, like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
Yeah. We're back. Dr. Martin, you have not done a Let's Get Checked since we did our Let's Get Checked the first time.
I need to do one again, yeah.
Yeah, but I feel like we both should. I feel like it's time to check something.
We should do it and we'll tell the results on air.
That'd be fun. Yeah, it's been a while. All right, so let's get into our next question. This one's great because it was on YouTube, and I apologize, Jessica C. I did not answer it right away, but I did tell you recently that we were answering it. It was just such a great follow-up question on our brow lift episode. So it was our episode about brow lifts, and this was the question. What is your opinion on a Transblepharoplasty Endotine lift? You mentioned endotines for the endoscopic lift, which sound like they are in the hairline. What about endotines placed directly at the eyebrow through the upper blepharoplasty? Do they also take a year to dissolve? Thanks in advance. Love your videos. Always so informative.
Oh, this is an awesome question. Jessica, thank you so much.
Such an interesting one. And
love you, Jessica.
Yeah. So, what's crazy is I said to someone yesterday, we were talking about, I can't remember what surgery, but I said, if this is the only tool in your toolbox, talking about a surgeon, that's what you're always going to go to. Oh, I do know. It was a patient who was talking about a esophageal issue and saw somebody who said they needed surgery, and the other person said, you actually just need to blow through this straw for a while and it will fix it. And that did fix it. So people who maybe don't do formal surgery, I think end up going to these endotines or less threads.
I think it's more like this. Okay. So a brow lift works, but can't we just make it better, right? So now we're going to start going through the upper eyelid incision.
Well, what if somebody's bald?
No, there's
has less hair.
Yeah, there's clinical scenarios where a transblepharoplasty endotine brow lift, which it's interesting because like that's a long term. So through the upper eyelid brow lift would work for someone who's bald, for someone who wants a less invasive approach. You just can't lift it no matter what they tell you as much as you can with a formal brow lift.
Yeah.
So you're only going to get a marginal lift. How you secure it with an endotine, with suturing, with different kind of methods is totally fine. Endotines themselves, the ones on the skulls can last at least up to a year. The ones that they do and I don't do that procedure, FYI, so I'm not the expert in that. But the ones that they do on the brow, those will go quicker because they're smaller.
Mm-hmm. Yeah.
It's definitely, I think it's a cool approach. I definitely think it's interesting, but ultimately it's the same problem with endotines and the brow lifts up on the frontal area or on like your hairline.
Inflammation, infection.
Yeah, or it just doesn't last.
They don't last.
Yeah, it doesn't last.
Yep.
And
Erosion.
that's the problem with transblepharoplasty brow lifts anyways, is they have a tendency to fall over time.
Which, as we talked about in our episode about brow lift is not a long-lasting procedure to begin with.
Yeah, but the way that I've been doing it recently is doing a hairline incision right in your, I say frontal, but what is the name for it? God.
Your frontalis?
Your front hairline? What is this called? Your forehead hairline?
Yeah. Your hairline?
Okay, whatever. The hairline above your eyebrows.
Yeah.
Okay. If you do an incision right in that hairline and you just elevate the skin, none of the meat, none of the muscle and the stuff below that is very long lasting and may last, in some cases forever. So if you're already doing an upper bleph and you want a little bit of improvement on the brow, I'm totally fine personally or professionally speaking, considering a transblepharoplasty endotine brow lift. But in terms of doing it as a better alternative to a standard brow lift, I don't agree with that at all. And so you're not going to have the same effect. But if you're already there anyways, you can get a little bit of an upcharge and have, someone who understands this type of procedure. I think it's totally fine.
Yeah.
And you could do it with suture materials too. You don't have to do the endotines.
Right. And I think that's kind of the bigger thing is endotines can definitely have some issues with more than anything inflammation. Some people really react to that suture material. Well, you can react to any suture material, but historically people have less reaction to more commonly used types of suture material than endotines. They can definitely be problematic for some people, but
the benefit is like a smaller incision. You're going through an incision you're already making for blepharoplasty. Probably a little less recovery, maybe some less swelling,
maybe a little less bruising.
Yeah, less bruising. It's very elegant. It's a cool surgery. I definitely do some things in this area similar. So all in all, I think it's really good, Jessica. I don't think it's a bad thing. And if that's what you're thinking, we support you 100%. Obviously, you have to go to a specialist and make sure they agree. But it's not going to replace a formal brow lift. If you're someone that really suffers from low brows, it's, in my professional opinion, not going to be able to elevate it enough to maybe even make most people happy. Secondly, the endotines, you definitely can palpate them, even the smaller ones. Mm-hmm. Third, they would take a while to go away no matter what the companies say. So those came out in the early 2000s. I may or may not have been in training at that point. I may or may not have used it right when it came out and may or may not have been.
You're not 25.
Very distressed when the patient came back with horns on their forehead. And she's like, how long is this going to last? So I was like, I have no effing idea.
Like, I hope not long.
Please go away. Anyways. So.
Yeah. So that's a great question. And like I said, Jessica, I apologize. It took us a little while to answer because our brow lift episode was a few months ago, but it was just such a great one. I wanted to save it and really be able to give it a little bit of time. So
I wonder if Jessica's going to see this episode. We'll see.
We'll see.
Thank you, Jessica.
Yeah.
Good question.
All right. So now we have another voicemail. Hooray.
Okay.
This one's from Tara.
Hi, Amy. My name is Tara.
Tara.
I am sitting here with my Omnilux contour face that I spontaneously bought listening to your episode on Saturday. They were not back ordered, and as a bonus, it is shipped out of the city right next to me, so I received it today, which is Wednesday. The question that I have is, I started listening to your podcast because I was getting a tummy tuck in December, and I was very nervous, so I was listening to a lot of things. I had it done. It was successful. I love it. All your advice was appreciated. But I'm 43 years old. I went today to get my normal. I get every 6 months I get the same amount of filler in my lips and the same amount of Botox in my forehead, and I've been doing that Botox for 10 years and lip filler for about 4. And I decided I wanted to get the Kybella for my little double chin that I have, and I asked her if I lost weight, and she said you could lose weight, but you could do it, and I decided to do it. My husband got mad at me and said I was going to turn into a Kardashian. And that I was becoming addicted. So what is your perception on addiction? I'm definitely not addicted. I purposely just go every 6 months so I don't have a plastic look. And I explained to him that Kybella is a 1 and 2 time once and done thing. But what is your opinion on addiction and Instagram making people feel like they have to look a certain way? I'm just curious. Thanks, you guys, so much. I love your podcast. Bye.
I love this question.
Oh, dude, I love Tara. Excuse me.
Tara.
Yeah,
I
love
Tara.
her.
So
I mean, like, I am so vibing off this woman right now because she just hit on so many things. First and foremost, the thing that, like, I almost love most about that voicemail was not the reason she called, that she actually utilized the stuff that we said, specifically that Amy said about recovery for your recovery from a tummy tuck. That's huge. This is exactly why we created this podcast, is to help people. So, Tara, thank you so much for saying that to us, because this is like a proud moment for me personally.
Well,
okay?
I hope you love your mask.
Yeah. Secondly, you got the mask. And third, somehow you figured out where it's being shipped from because you're awesome. And you got it in a day, which is still blows my mind when I order stuff from Amazon. I get it the next day, but that's okay. The point that she was really making, and I want you to really go into this, Amy, is about self-perception. We have a great episode on that. You should definitely listen to that. About sticking to a program that honors you, your natural aesthetic, and then also checking yourself, really. But it is very, very hard right now. It is extremely hard. I mean, our competitors, plastic surgeons, even us sometimes, they tend to put like these kind of results up, and you see this kind of result or this kind of body type and stuff like that. Amy and I talk about this all the time with social media, with everything we're doing. This podcast represents our need and desire to tell the truth and just really get real information out there. The visuals, though, I think are really hard for people. They have a hard time with their own self-perception, looking at social media. They're getting a lot of cues that maybe don't fit a natural aesthetic.
Well, and even on Instagram, you're not even looking at that person's real face. They have filters on.
Right.
Which, again, can be very challenging when you're looking at constantly not only potentially augmented faces, but then filtered faces. It really messes with how you perceive what a person should look like. I think the thing I love the most about this is I feel like we both have a pretty strong feeling about this, but we're probably pretty similar. Do you want to answer first about the addiction component of plastic surgery and the social pressure, or you want me to?
You go first.
Okay.
Because I think, honestly, if we're being transparent with each other, you deal with it more because you're female, and I get just a free pass, even though I look like slightly above average. Maybe if there's 50% is average, I'm 51% in terms of the looks category.
What's that, Matt Damon?
Yeah, exactly. But that's good enough, and I think that women, especially in their 30s, 40s, and 50s, are really pushed against the wall when it comes to expectations on looks and stuff like that.
Well, that does not end. Yeah. I think it only increases as a woman ages, unfortunately.
Yeah.
Like
so you answer it first.
Yeah.
Go ahead.
I think the addiction question is a really salient, interesting thought. And I think that a spouse or a partner is, always going to be concerned that you don't have an addiction, right, to whatever it is that they see you doing, because they value you for you and don't see the outward part of it as much, which is amazing. I mean, it's amazing you have a partner in life who feels that way about you.
And there was an episode we did, I think it was the self-perception episode, where I mentioned, it was in a study, that people that you're close with they're less likely to be able to name very specific details about your face and your body, because when you love somebody, it rises above those small like you could more easily tell the details about someone maybe who's an acquaintance. Isn't that funny?
Yeah, I think that's probably true and false, like that
I guess
probably,
it depends on the relationship.
Yeah, it depends on the person.
Yeah.
But, obviously that's there. And we've said it before, like I call it the stars in the sky. Like people will have a small cosmetic procedure done and then, oh my gosh, like it opens their eyes to like, well, A, I didn't die. B, it worked. And C,
he's awesome. Yeah.
Like what else can I do?
Exactly. It happens every single time.
Yeah.
What's next? Like everyone thinks there's always a sequel. Like if you have a blockbuster movie, you got to follow it up with,
Yeah.
Pirates of the Caribbean too.
And I think the addiction component comes from that. People get really enamored with the ability to change themselves in a positive way. But the downside of that, as we talked about in our podcast about happiness, about does plastic surgery make you happy, is that the opposite can be true as well. Like, oh, I did this and I am not perfect. I still need more done. Like, people don't love me more. My husband still left me. I haven't met and married a rich person, male or female, whatever.
My kids are still messed up.
Right. It didn't fix things. So you want to do more because it didn't fix the issue. So you can get addicted because it worked, or you can get addicted because it didn't, in your mind, quote unquote, work. It didn't give you the outcome you expected, even though the outcome was not physical.
But addiction denotes a true addiction. And I don't think people get, quote unquote, addicted to plastic surgery like you would think of with medications and stuff. I do not think that.
Right.
But now, that there is a subset of this population, very small, that gets plastic surgery. They have true body dysmorphia. That's totally different. They have a clinical diagnosis.
And you're still addicted to the outcome.
Right.
Not to the surgery
I don't
itself.
think they're even addicted. I think addicted is the word is being used incorrectly here.
Well, but I mean,
as a medical related podcast, addiction itself.
Right. You have self-harming habits. So people who are going into extreme amounts of debt to continue to have surgery, I would say is somewhat an addiction. People who are ruining relationships, like if you have a partner who disagrees with your desire to continue having surgery and you continue to do it, I definitely think that the surgery can fall into the addiction category for those reasons. It can put you in debt. It can end relationships.
Look at Tara. Tara's just getting a wedge between Amy and I.
Like, you can't be addicted.
Because Amy's making really good points right now. This is what I hate about Amy. I should never have started a podcast with her. Because then I'll go home tonight. I'll be like, oh, maybe there is an addiction there.
I'd say there can be because of those specifics.
I think clearly from her conversation, what she was saying, I don't get that sense from her that she, quote unquote, is addicted. People going to get fillers and Botox every 6 months is pretty standard, at least in areas where people do that kind of stuff.
Well, there's a difference between maintenance and addiction. I mean, I wouldn't say anybody thinks that the person who has gotten their haircut hundreds of times over the course of their life is addicted to their haircut, right? Would you ever say that?
I don't know. I mean, by the way, what's this deal with coloring of the hair? Why is that so expensive? Why?
I don't color my hair yet.
Because you're so awesome.
Well, because red hair, once it goes, you can never get it back.
You can't get that nice red.
You can't.
Yeah.
It always looks fake.
So you get the real red like Sally Jesse had.
Yeah. So like, I guess in my life, I've seen that, and been like, wow, I should maybe not mess with my hair because once it goes away, I'm going to have to do something. So
it seems like it's like exorbitantly expensive. How expensive could this dye be?
Maybe.
Is it the time that you're there?
I mean, you are there for a long time when you have your hair dyed. We could have hairstylists on.
We should.
I mean, the same could be said for Botox. Like, it takes a split second to do, and it's expensive.
But that's the cost of the Botox itself.
Oh, well, maybe it's the cost of the dye. I don't know. How expensive is this dye?
Well, anyways, going every 6 months, Tara, is absolutely not excessive. Limiting yourself, to a vial or whatever and putting it in certain areas is not excessive. I just watched a really interesting video. It was an English doctor, and he was talking about how long fillers can last. He did an MRI study. It can last years. The companies say 6 months to a year. And that's kind of, you think about, a little bit insidious and self-fulfilling. They don't want to tell you it could last longer.
Well, but I can tell you this, when your filler's gone.
Yeah. But it can migrate. The filler can migrate.
Yes.
So that's why it's important to limit the volume, like maybe stay to a vial and don't try to get, because everyone always thinks more is better. It's not.
Yeah,
so really limiting that. In terms of Botox lasts maybe 3 months. So you can tell your husband, like, the Botox, you're actually you should be more like every 4 months, to be honest with you, for the Botox.
Botox goes away. And I always say with both of these things, Botox and filler, the good thing is if you love it, it goes away. If you hate it, it goes away.
Right.
So one way or the other, it's going to go away.
That's like board-certified plastic surgeon. You say that every episode.
Yeah. It goes away. So if you love it, it goes away. Kybella, though, is an interesting thing. Because like you said, it is essentially a one and done. I mean, some practitioners do a mega dose. Essentially, they do all the vials at once. Some people do it in 2 sessions. Either way,
Kybella
once
is basically the produced version of the the compound that's in your bile that helps it.
It starts with a D.
Yeah, deoxycholine or something like that.
Hexachlorotic acid.
Whatever. I don't remember. I'm sorry.
That wasn't it.
So it's what takes the fat and kind of digests it down.
Yeah, it's the enzyme that breaks up the phospholipid bilayer.
And that's what they inject underneath. I could take it or leave it. I'll be honest with you, Tara. I mean, if I'm just being straight with you, and I'm being straight with you, Tara. I'm not really a big fan of Kybella. I just don't think, I think I could just do a little liposuction in 30 minutes. It would just do a lot better for you.
Yeah, predictable, replicatable.
Yeah, a lot of people have swelling after Kybella.
Yeah, like wicked
some
swelling.
Knottiness, and that feels like wood, and it takes a while for it to go down. But it does work. We've had a lot of patients have good outcomes from it, so it's not bad. If you get a good price on it, it has a low risk profile. And your husband would probably be better with that than you going to actually do surgery with somebody like me. But I don't get from her that she is addictive, but I do understand the concern of her husband. We talk about that all the time in our practice, about representing for you, the patient, doing right by you, being open and honest with you, and helping you find your best version of you, and not try to reach out and try to be all these things. She brought up the Kardashians, so I could bring it up. One of the Kardashians was suing everyone because there was an untouched up photo out there. Well, I don't remember which one. I could care less, but I just thought that was just hilarious.
Right.
You know,
to get
that's
it
where
taken
we,
out. Yeah, to get it all
that's
taken
where we
down.
are in our world, that if you have an untouched photo, they don't want it out there because you could see her cellulite or whatever it is.
Well,
By the way,
that's my point,
80
though,
to
with
90% of all
filters.
women have cellulite. Yeah.
Yeah, like the filters are the same thing. I mean, what you're looking at on social media is not achievable even with plastic surgery. I mean, these are filters a lot of times that are causing someone's skin to look like completely flawless. You know, or their body contour to be that is not natural for them as a human, given their bones,
Right.
you know, and their organs.
Yeah, and you know, you want to get real all up in it. I mean, we in some ways benefit from that, right? Because people are feeling like, oh, I need to get this done, I need to get that done, and that's just devastating, right?
Or why don't I look like this? Or how does this person look like this?
So I think she's asking really important questions. I don't really know if we gave you an answer, but I definitely don't think she's addicted, and I do think that the concerns that her husband has are valid. Also, at the same time, not many patients are it seems like as organized and pragmatic as Tara. So like, that's a really good sign.
Yeah. I mean, I think about it, the Instagram and the social media component, more so even with people. I mean, she's in our age group in her 40s, but I think of children who have, especially in the last year, haven't seen people, A, without a mask on, B, the only times you're seeing people is on social media that are filtered, that are altered. Do you even know what a real human looks like? Like, it's okay to have visible pores. Like, people have wrinkles when they smile. Like, you know, I think as a society, this is a bigger issue than on an individual level. Like, are we losing touch with what a person should look like?
Exactly.
You know, I think, and that is a question far bigger than our podcast, but it's one that is fascinating to me because it's all tied together, you know, and then you have this reaching and this yearning for a life that isn't yours, but a life that isn't theirs either.
Right.
You know, you're seeing the highlights, and I know these are all trite things at this point, like, oh, you're seeing somebody's highlight reel, like blah, blah, blah. Like, yeah, you are. But more than that, like, you're building a story about that person in your head based on what they're putting out there that's not even completely true. They don't even look like that. Like, they're suing people to get a picture of them taken down. I mean,
Oh, you do what I do, just post pictures of your dog in nature or me in front of nature.
yeah, I mean, those are always good. But, you know, I'm serious.
That's all I do.
Yeah.
I'm so bad. People are like, why don't you self-promote? I'm like, I just don't feel like it.
Yeah. At the end of the day, in real life, when you see a person who has had plastic surgery that has been excessive, we talked about how to age like a Hollywood superstar on a recent episode. You know it when you see it, you know, so I think we all need to kind of get back to seeing more people in real life and like embracing people for their differences and seeing the uniqueness of a human that can't be matched by surgery. Like, having a surgery can make you more beautiful on the inside.
Exactly. But the flip side of that is I love people that have fight and they want to do what they can to feel the best. To not give up, to not just throw in the towel. And Tara, you keep doing your Botox and fillers responsibly.
Just tell them you're getting your vitamin B shots.
Exactly. Tell them you're
It's
going.
for health.
It's for your health.
Yes, vitamin B. It's important.
Yeah.
Capital.
All right. Well, that was an awesome voicemail.
I loved it, and I'm so glad you got your mask, and I'm so glad they're back in stock, and I think they are back in stock everywhere now. So the mask she's
Do you
referencing,
think they sold out because of our podcast?
No, they were sold out before, and that's what I
okay.
mentioned on the podcast when we did our podcast for the things we're into 3.0 or stuff we're into. I talked about the Omnilux mask and how much I love it, and I still love it. I actually I use it in the morning now more than at night, just because I just do. It's very flexible. You can use it whenever. If you want to see put it on the podcast,
it's not time limited.
No, you can go watch it, and then the timestamp on that episode to where I put the mask on is there. So you can watch me put the Omnilux. It's an LED light mask for anti-aging and inflammation.
Our friends are visiting, and we were watching some show, and in the show, it was Dave. This K-pop star gets in a SUV, and then puts on an LED light mask. It's not the same one. And my friend was like, what the hell did she just put on her mask, her face? And I go, this. And I reached behind the couch and pull it out.
Oh my gosh,
it was
you
awesome.
didn't.
It was just like perfect. And he's looking at me like, what are you doing with your life?
Right, like I have one of those right here.
Yeah, exactly.
It's like
I'm just like a K-pop star.
It's the Truman Show, the product placement. Like, would you like
exactly.
a can opener?
It was a Truman Show situation.
Yes. You mean this product placement?
Oh, do you mean the Omnilux 2000?
Yes. Product placement
Yeah.
here. So thank you everyone so much for listening to this episode. And as you can see, we really do genuinely love questions from our listeners. If you'd like to leave us a voicemail.
I mean, I would just to be honest with you, if every episode was questions from the listeners, it would make me happy. So please, leave the voicemails.
Yeah. So
what is the number, Amy?
The number is right here on the screen.
Here.
It's 303-630-9038. It's also in the comments or the description box below, so our timestamps to each of these questions. So if you are listening and you're you and you want to hear just your question, you can jump to that spot in the podcast. If you would want to watch us on YouTube, that's on YouTube at Jason Martin MD. I do listen. I watch the comments. I listen to your voicemails. I love the interaction, and we would love it if you would share us with your friends if you do find this helpful, or your mom groups.
Yeah, we
Swell
love mom
Health.
groups.
Yep.
Facebook groups.
Mm-hmm.
We're down with that
Share
too.
us with your ladies of the knife.
Yeah.
And thank you everyone so much for listening, and we'll see you next time.
I think, honestly, I'm just going to say this now. I think you should wear the glasses more often.
Really?
Yeah. They look really, really good.
Thank you.
Yeah.
We'll see what the people
I need
think.
to step up my glasses game. Maybe I'll get blue glasses.
Those are your new glasses.
I know,
They
but
are
I
more
need
blue.
colorful glasses that make my eyes pop. You're kind of like when Nils got his hair cut. This is one of those
Showing us up.
situations. Everyone's showing me up.
Mm-hmm.
I shaved today, so that was a
you
positive.
did.
Yeah, it was good.
It was very good.
All right.
All right.
See you later.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.